coming. Like Dr. Miller said, my name is Brooke Loomis, and I will be presenting on adaptive expertise in medical education. So my field site. This summer I interned at the Penn State College of Medicine, which is part of a larger system that includes the Milton S. Hershey Medical Center as well. Most of my time was spent working in the Department of Humanities, and the Penn State College of Medicine was the very first med school in the nation to have its own dedicated Department of Humanities, as well as the Department of Family and Community Medicine. So you could say that from the very beginning, this med school was focused on holistic education, teaching that cultural competency is just as important as knowledge in the biomedicine sphere as well. And this opportunity was a rare opportunity for me because I come from a public health background, so being able to work in the medicine sphere really allowed me to see the other side of the coin, if you will. So at the most basic level, medicine's goal is to improve the health of an individual. However, the clinical care of a patient is just the tip of the iceberg for an individual's health. For instance, this chart shows some social determinants, and so things like education, income, race, and ethnicity, and other factors all come together to influence an individual's health as well. And for example, there's research that shows that your zip code is a very good indicator of your health outcome. Your zip code corresponds with things like your education system, where you are, what school zone you are zoned in, what school district you are zoned in, your physical location of your house. Do you live in a safe area? Do you live by a grocery store that sells fresh produce? Your zip code can also predict a family's income as well as your race and ethnicity. So this summer I had the assignment of reading Richmond's one book called What the Eyes Do Not See. And this book is a perfect combination of public health as well as medicine. And Dr. Mona Hanna-Attisha, the director of pediatric medicine at Hurley Medical Center, wrote about the Flint, Michigan water crisis. And in this book, she talks about the real-life example of zip codes predicting an individual's health. So her research shows that there's a correlation between high lead levels in children and their corresponding zip codes. And these zip codes were receiving the corroded water source. So the majority of the people who lived in these zip codes who were therefore affected by this corroded tap water were primarily people of color and people of low income. So you could say that a health inequity does exist within the United States, and it's predictable. Low income people of color are more likely to have poor health outcomes, and a shorter lifespan than their counterparts. So because of the role these social determinants of health play on the lives of an individual, it is important for a physician to understand these and study them going forward. So where do we start? As the health and medicine community, our goal is to combat these health inequities and improve the health of everybody. So the best place to start is at the institutional level. Institutional change results in the greatest impact in sustainability. And what better institution to start at than at a med school, where we're training the future doctors of tomorrow. And my internship supervisor, Dr. Paul Hayden, who is the director of medical education research, believed that the best place to cultivate this change was through the physician-patient relationship. And improving this relationship was holistic in its approach as well. You didn't just learn the biomedicine and diagnoses of symptoms, you also learned interpersonal and communication skills. In fact, he shared stories about students coming back to him years later, telling him that the most important lessons that they learned in med school were about how to communicate with their patients. So the Penn State College of Medicine believed that the patient-physician relationship could be improved by teaching adaptive expertise. So what is this? Adaptive expertise is defined as a broad construct that encompasses a range of cognitive, motivational, and personality-related components, as well as habits of mind and dispositions. By using adaptive expertise, students will be able to apply knowledge effectively to atypical cases that might require new procedures for solving this unique problem. And this means utilizing cognitive flexibility that enables students to adapt to the ever-changing environment of a doctor as well as the ever-changing lives of their patients. And so these are just a few ideas of how adaptive expertise improves is crucial to the occupation of a physician and how they all come together to create a prosperous patient-physician relationship. So the next question becomes, how do you teach adaptive expertise in the classroom? Which brings me to one of my main tasks this summer, which was to create an online platform for the Jazz in the Art of Medicine course. And the description of this course states, the teaching of communication skills in medical school focuses on basic skills in isolation, rather than helping students to translate these skills into the messiness, uncertainty, and time pressure of actual medical practice. This course is designed to develop one's ability to improvise using basic skills and applying them patient by patient in unique and creative ways in actual practice. In a sense, such real-time translation of basic communication elements is what jazz musicians do when they play together. So students who take this course learn to marry the contradictory yet complementary topics of structure and freedom within a conversation. They learn to listen for meaning and respond appropriately to the needs of their patients. And they also learn to develop a particular style and voice that evolves over time. Another class that I focused on was the critical thinking class. The professors in this class taught the difference between System 1 and System 2 thinking. And to sum it up briefly, System 1 thinking is fast, based on emotions and pattern recognition. And System 2 thinking is slow. It causes you to critically and analytically think through a problem. And this type of thinking also triggers techniques of adaptive expertise. And the professors of this class also challenged their students to use the 5 habits of mind alongside this System 2 thinking. The 5 habits of mind including intellectual humility, curiosity, balanced skepticism, open-mindedness, and metacognition. So how do these adaptive expertise techniques play out in the real-world patient contact? Through the improvisation class, students learn to listen for meaning, listen for context, and listen for an individual's personal history. This allows insight into the patient's life beyond the doctor's office. So for example, students learn that a patient might not be taking their medication because they can't afford their medication. Students learn that patients might not be showing up to appointments because they have no means of transportation. Additionally, through these classes, they have developed their own particular style and voice, which lays the foundation for a conversation. They go with the flow of a conversation, listening to and expanding upon what the patient deems as important, but they also guide the conversation so that it benefits both parties involved. And through the critical thinking classes, they taught a process of thinking or metacognition. It challenges a student to be adaptable, which translates to improvements in diagnoses as well as improvements in treatment plans for the individual patient. And so both of these elements translate to cultural competency. As a physician, you don't just analyze your patients, you analyze yourself as well. So what techniques am I using? Are they effective? And how can I change so that I'm being more efficient and effective in my workplace? And so through cultural competency, you are building a patient's history, as opposed to taking one's and projecting your own perspective onto that patient. And this is something that Dr. Hayden had researched and written about extensively. So all of the previously mentioned factors are taught, practiced, and improved upon through these courses, which foster a prosperous patient-physician relationship. And this is important because healthcare is shifting towards a more patient-centered model. And a good patient-physician relationship has been shown to lead to better health outcomes by increasing patient satisfaction, leading to greater patient understanding of health problems and treatments available, contributing to better adherence to treatment plans, and providing support and reassurance to patients. So lastly, I just wanted to thank my internship site as well as my internship supervisor for allowing me this opportunity. Also wanted to thank Dr. Miller, the CCE, and everybody else involved in the Civic Engagement Fellowship for allowing me this opportunity to explore the nonprofit sector through the lens of health.